In this video, we'll be looking at the top causes of eye problems that affect our eyes. People have eye problems at one time or another. Some are minor and will go away on their own, or are easy to treat at home. Others need a specialist care. Whether your vision isn't what it used to be or never was the great, there are things you can do to get your eye health back on track. See if any of these common problems sound familiar, and always check with the doctor if your symptoms are really bad or don't clear up within a few days. 1. Eye strain. Anyone who reads for hours, works at a computer, or drives long distance knows about this one. It happens when you overuse your eyes. They get tired and need to rest, just like any other part of the body. If your eyes feel strange, give them some time off. If they are still weary after a few days, check with your doctor to make sure it isn't another problem. Night blindness. Is it hard to see at night, especially while driving? Is it tough to find your way around in darkness places, such as movie theaters? That sounds like night blindness. It is a symptom, not a problem in its own right. Nearsightedness, cataracts, keratoconus, and a lack of vitamin A all causes a type of night blindness that doctors can fix. Some people are born with this problem, or it may develop from a degenerative disease involving the retina, and that usually can't be treated. If you have it, you will need to be extra careful in areas of low light. The second one is lazy eye. Lazy eye, or you can call it presbyopia. It happens when one eye doesn't develop properly. Vision is weaker in that eye, and it tends to move lazily around while the other eye starts put. It's found in infants, children, and adults, and rarely affects both eyes. Treatment needs to be sought immediately for infants and children. Lifelong vision problems can be avoided if a lazy eye is detected and treated during early childhood. Treatment includes corrective glasses or contact lenses, and using a patch or other strategies to make a child use the lazy eye. Another one is cross eyes, or you can call it strabismus and nystagmus. If your eyes aren't lined up with each other when you look at something, you could have strabismus. You might as he call it cross eyes or wally. This problem won't go away on its own. You will need to get an ophthalmologist or eye specialist to correct it. With nystagmus, the eye moves or jingles all the time on its own. There are many treatments, including vision therapy, to make your eyes stronger. Surgery is also an option. Your doctor will examine your eyes and see which treatment might work best for you. When you can't see certain colors or can't tell the difference between them, usually reds and green, you may be colorblind. It happens when the color cells in your eye are absent or don't work. When it is most severely, you can only see in shades of gray, but this is rare. Most people who have it are born with it, but you can get it later in life from certain drugs and diseases. Your doctor can tell you what is to blame. Men are much more likely to be born with it than women. Your eye doctor can diagnose it with a simple test. There is no treatment if you are born with it, but special contacts and glasses can help some people tell the difference between certain colors. Another one is uveitis. This is the name for a group of diseases that cause inflammation of the uvea. That is the middle layer of the eye that contains most of the blood vessels. These diseases can destroy eye tissue and even cause eye loss. People of all ages can handle it. Symptoms may go away quickly or last for a long time. People with immune system conditions like AIDS, rheumatoid arthritis, or ulcerative colitis may be more likely to have uveitis. Symptoms may include blurred vision, eye pain, eye redness, light sensitivity. See your doctor if you have these symptoms and they don't go away within a few days. There are different kinds of treatment for uveitis depending on the type you have. Another similar problem is presbyopia. This happens when you lose the ability, despite good distance vision, to clear, see close objects and small print. After 8:40 or so, you may have to hold a book or other reading material further away from your eyes to make it easier to read, sort of like your arms are too short. Reading glasses, contact lenses, LASIK, which is laser eye surgery, and other procedures can be used to restore good reading vision. So these are the 7 top causes of eye problems. If you have any question, you are free to comment below so we can answer your question. And also, if you have any causes again relating to these problems, you can also comment below. Thank you.